this morning. Today, we're going to be speaking about, um, well, the importance of being a counselor, um, what it means to be a counselor, and then specifically what it means to be CAC or CAP. And I'll certainly share my own experiences. So firstly, right out of the gate, um, what it means to be a counselor is to have a lot of responsibility because you are a change agent in somebody's life. You are someone who could be their role model. You are somebody who is an educator, is a teacher, somebody who is a listener. And if you think about those things that are attached to being a counselor, it's extremely important, and it's a lot of responsibility and accountability. Um, what you're doing as a counselor is not necessarily giving people the answer to things, but what you are doing is you are getting them to organize their thoughts. And specifically with CAC and a CAP, you're honing in on issues that people have had with substance abuse, with alcohol, and their lives have become unmanageable. So within that context, you are discussing people's core belief systems. You are discussing high risk situations that people find themselves in. You are discussing the maintenance of substance use and substance abuse. In other words, how is it impacting your life, and where are you along the spectrum of substances? And to that effect, again, you're educating them as to where the person might be in their journey towards recovery or their journey towards continued use. And so, as a counselor, you want to break down things and make it very simplistic for the individual. Number one is you want to discuss the history of their substance use, and determine, are they a abuser? Are they a user? Are they dependent? Or are they a full blown addict? And you determine that by consequences, by what the client is telling you, and you are able to identify where the person is at along the spectrum, and therefore by determining where they're at, you can work with them within that context. So there's a lot of active listening that goes along with this. You don't want to assume anything, and by active listening, which is a tremendous skill, is you are reflecting back what you think you're hearing from the individual. You are also interpreting some of the things that the client might be saying to you, and checking it out with the client. Does it feel right? Does that sit well with you? What do you think about what do you think about this? And again, uh, that then gets into a person's belief system, which is really where you want to go with all of this. You want to challenge a person's belief system. You want to challenge that. You want to challenge them that their way of doing things is not the healthiest way. You want to discuss and explore with them, the meaning behind using drugs and alcohol. The bottom line is when someone is using, they want to change their mood, and it means that they're uncomfortable in their own skin. Their emotional regulation is off. Their thinking is off. So again, as a counselor, like you'll be doing all those things. Um, Being a counselor is not for everybody. Um, you have to self-regulate. You have to take care of yourself. Um, in some senses, you're a role model for appropriate behavior. I mean, you need to be perfect, um, but you should pay attention to your physical well-being, your mental, emotional state, um, your social well-being, and your spiritual well-being. If you're a recovering addict or alcoholic, are you maintaining? Are you going to meetings? Are you doing the things that you need to do? Are you seeking out supervision? Are you exercising? Are you eating right? Is the job too stressful for you? So these are all things that that as a counselor with a CAP or CAC, you want to consider. The other thing, another thing that that you want to be aware of is ethics, ethics and morals. Asking yourself the question, where's the line in the sand? What are you not willing to do? What you are willing to do, and how are you going to seek out guidance when you're in some of these dilemmas? There's some easy ethical situations that that for a fact are not that they're not okay. Should never sleep with a client. You should never um, perform or do counseling above your certification. Um, you should never be friends or sponsor a client. These things are like the headliners for ethical practices. For a counselor. So it's important that you read the code of conduct, that you know what your role is, what you can and can't do. Again, I want to be clear though that as a counselor, you're not telling people what to do, and that's an important distinction. You have to do a lot of listening. If you're doing most of the talking, other than education, right, and teaching them some skills, um, something's off. You want the client to be able to talk and sort of talk out their beliefs, talk out their scenarios, talk out their situations, their fears, positive and negative qualities, all of that stuff, and also in combination with creating a trusting environment. So the ethics of it are very, very important. You have to have what I said before, which is this self-regulation. If you think that you cannot adhere to some of the basic ethical things that that the profession asks of you, then don't be in the don't be in the field. So that's very, very important. Um, I will say this, that as a counselor, I have found that many people go into the counseling industry to fix themselves, to look at their own issues, and that in and of itself is, well, it's dangerous to do that, because then you get into a lot of what's called transference and countertransference. You start to over identify with your clients. You start to tell them what to do. You try to fix them, really enacting a lot of the behaviors in your own personal life. And again, this is not a friend. This is not a confidant. This is a client, and there are professional boundaries. And you can't help everyone. You certainly can try, but you can't help everyone. And so it's important that the counselor has a counselor and a strong supervisor. that is that's essential. So having again, having your own maintenance, having your own counselor so that you can talk about issues, vital. Having a supervisor, whether you're a CAC or a CAP or licensed or not licensed, whatever, but having a professional in your life where you can share some of these these difficult situations, dilemmas, questions, and somebody's going to give you some honest feedback is important. The role of a supervisor is someone who guides you in the right direction, someone who points things out to you that maybe you're not thinking of, someone who will confront you or confrontation, so to speak, in a way that it refocuses you. Supervisor is somebody who you should be able to call in an emergency situation, somebody to bounce off ideas that you're thinking about, things that you're trying, so on and so forth. So real important to have that relationship, but at the same time, be able to take care of yourself personally with with a professional counselor. Being a counselor is again, it is a lot of responsibility. I cannot stress the following enough, that whatever you do in your sessions needs to be documented appropriately. Documentation is critical. A, to get paid, B, to get paid by insurance companies, and C, to have a log of what you actually have covered and the goals that you've set for yourself and set for the client are all documented. If you didn't document it, you could be Sigmund Freud, you could be the greatest counselor in the world, and it never happened if it wasn't documented. And so if it's not documented, or it's poor, or it's sloppy, that could come back to haunt you in ethical ways and actually in legal ways as well. So real important that documentation it's really an art. It's really something that you have to work at. It's not something that you can just turn on and turn off. Documentation is vital, and the best way to do documentation is to practice. There's different formats. The traditional one is your DAP format, data assessment plan. Data is the information, objective information that's being portrayed. Assessment is somewhat subjective, but you're giving your professional opinion of what's going on, back it up by evidence. And then the plan is you're setting a goal for next time, or you're indicating that over the next X amount of time, these are the things that we're going to be working on. So that's a real important piece.